Welcome to the Dr. Mudgil podcast. This is episode 91. We are slowly creeping up on 100. Can't wait to get there. But this podcast is going to be something. It's going to be about something that I see a lot of. There's actually something that we had quite an uptick of during the pandemic. It's going to be a hashtag Ask Dr. Mudgil format podcast. And this question comes in from Reddit. And the question is, had perioral dermatitis a few years ago, which cleared after a round of antibiotics, have got it again? The rash has been there for a few weeks and now isn't going away, and now seems to be traveling to mouth corners. It's dry, flaky, and bumpy, and it's feeling a lot like it was last time. So the person in this photo is describing a condition called perioral dermatitis. And I'm sure during the pandemic, you guys saw all of these articles about maskne and how that there was just tons of maskne happening, which was like an acne-like eruption underneath the maskne. Turns out maskne was actually perioral dermatitis. And I'm going to describe to you guys what this is and what can be done about it. It's something that we see a ton of. It's something that we've always seen a ton of, to be honest with you. But there was a pretty significant uptake of perioral dermatitis during the pandemic when everyone was wearing masks, anytime that they were outside, etc. So perioral dermatitis is like an acne-like eruption that typically occurs around the mouth, perioral. It's actually periorificial dermatitis. It can occur around any orifice. So a lot of times patients will have this acne-like rashy eruption around their mouth, but they can also have it around their eyes. And treating perioral dermatitis is more like a marathon than a sprint. And folks that are predisposed to getting perioral dermatitis can have relapses of it, like what this patient is describing. Now, as I always say, if you suspect you have this, you need to get in to see a board-certified dermatologist who could properly evaluate your skin and put you on the appropriate therapy, which I'm going to go over in a minute. Any dermatologist can only tell you so much from just looking at a picture with a description. But you got to get in so someone can clinically examine you, feel the rash, and give you a proper diagnosis and then the appropriate intervention for that diagnosis. Now, perioral dermatitis, just to talk about causes. The classic cause of perioral dermatitis is the use of steroid creams on the face. So frequently, a patient who has perioral dermatitis will use a steroid cream and it'll actually make the rash go away. But then it comes back with a resurgence, and it's kind of like putting gas on a fire. So a lot of patients kind of fall into this trap of using like a topical steroid on their face. Their rash goes away, comes back a little bit worse than it was before. They use a topical steroid cream again. Same thing happens until it just really snowballs and doesn't respond to the steroid cream at all. So I'm not sure if that's what's been happening with the patient who asked this question, but definitely, cutting out steroid cream is key if you have perioral dermatitis. There are also tons of other potential triggers. There's some speculation that some ingredients in certain toothpaste can trigger perioral dermatitis in the predisposed folks. Various cosmeceuticals, lotions, and things like that. If you have a particular sensitivity to a specific ingredient, it can trigger perioral dermatitis. Occlusion alone can do it. So, when we were all wearing masks, basically all of the time or for many hours of the day, that alone can be irritating to the skin and trigger perioral dermatitis in those who are predisposed to it. So there's lots of causes of it. It is very common. Like I said, we have seen an uptick of it in recent years, predominantly from the use of masks. But now it's kind of starting to trend down a bit, although I still do see a ton of it. So like I mentioned, the treatment is more of a marathon than a sprint. So typically what we do for our patients is we put them on a low-dose oral antibiotic for at least a month. And I also use a cream. Most dermatologists do the same thing, I'm sure, which is a steroid-sparing cream. So we use something called pimecrolimus or tacrolimus, and you apply that topically twice a day. So what I have my patients generally do is they do that for a month, they come back, and if the rash has resolved, then I'll start to taper them off of the oral antibiotic. And they'll do the low-dose oral antibiotic every other day for a month and then stop. But the key really is continuing to use the cream. And sometimes you have to do that for several months to really knock out perioral dermatitis. So what I generally recommend my patients do is, even if the rash has completely gone away, still use the cream twice a day for a month to really beat it down and to prevent a recurrence. Like I said, in your case, it sounds like you were treated, you were put on an antibiotic, I think you said in your description. I'm sure you're probably given some creams as well, and it sounded like it was several years ago. everything was cool, and then the rash has recurred several years later, which is a pretty typical thing that can happen. But what I would recommend you do is get in to see your dermatologist so they can put you back probably on the same treatment that you were on before. So I hope that answers your question. If you have any questions about perioral dermatitis, please drop them in the comment section below. Again, this is something that's sort of like bread and butter for all dermatologists. And if you're suffering from this condition, just get in to see someone. Obviously, within the New York area, you're welcome to come see the doc. But if you're not, I'm sure you can find an amazing dermatologist wherever it is that you are. So with that, let's get it.